The US spends nearly double per person on healthcare compared to the UK or Canada, and gets worse outcomes on almost every measure. Free healthcare isn't free. The real question isn't whether to pay, it's how and who gets left out. Today, we put universal healthcare on trial. The case for, the case against, what's actually changing about being sick, and the verdict that depends on a question almost no one asks. First, the case for, because on raw outcomes, the universal systems beat the private one, repeatedly, measurably. Health is what economists call a public good. Vaccines work better when everyone gets them. Treated illness doesn't spread. Healthy workers are more productive. Your neighbor's health quietly affects yours. Markets handle public goods badly. They always have. The US spends about $13,000 per person per year on healthcare. The UK around $5,000. Germany around $7,000. Same medicine, same surgery, same drugs. The private system in America costs nearly twice as much and still leaves tens of millions without coverage. On life expectancy, the US is below most developed countries. On infant mortality, worse. On preventable deaths, worse. Universal coverage countries score better across nearly every aggregate health metric for roughly half the money. The maths is uncomfortable. Medical bills are the single largest cause of personal bankruptcy in the United States. In the UK, in Canada, in Germany, that number is effectively zero because nobody loses their house for getting sick. That alone is most of the case for. But the case against isn't ideological, it's structural, because universal systems have their own real, measurable problems, and pretending they don't is dishonest. NHS England, waiting list, over 7 million people. Canada, median wait for specialists around 6 months. Some surgeries over a year. When healthcare is rationed by need instead of by price, the queue becomes the rationing mechanism. The queue is real. The pain in it is real. Healthcare spending is the single biggest driver of public deficit projections in every developed country. In the UK, the NHS now consumes around 40% of day-to-day government spending, up from 20% in 1960, and rising every decade. Staff shortages, outdated equipment, burnout. The NHS has among the lowest doctors per capita in the developed world. Patients wait. Diagnoses slip. The morally elegant model of universal access has practical, measurable limits. Truly free healthcare creates overutilization. People consume more than they need. A GP visit because it's free, not because it's necessary. Most universal systems quietly use copays, gatekeepers, or rationing precisely because pure free doesn't work either. And much of modern medical innovation has come out of the US system. New drugs, new devices, new techniques. The private profit motive funds research that universal systems often free ride on. Take that away, pace of progress slows globally. So is universal healthcare the answer? To answer that, you have to see what changed since these systems were designed in the 1940s. When the NHS was founded in 1948, average UK life expectancy was 68. Most people died of acute conditions. Today, life expectancy is over 80. Most spending now goes to chronic, complex, lifelong illness. The systems weren't designed for this. The maths is breaking everywhere. Modern medicine can do things that were impossible 80 years ago. Cancer survival up, heart disease survival up, babies born at 23 weeks survive. Each miracle is also a bill. Universal coverage was easier when there was less to cover. Now, there's no upper limit. Which brings us to the verdict. And it's neither pure free nor pure private. It's a question both sides skip. Universal healthcare is more efficient, more humane, and produces better aggregate outcomes than the US private model. And every universal system is straining under demographics and tech costs. Both are true. The honest debate isn't free yes or no, it's how to ration humanely. The right question isn't should healthcare be free? It's how do we ration? Because someone always rations. By price, by waiting time, by gatekeeper, by coverage exclusion. Every system rations. The question is just which method matches your values. 3 rules. Universal access to essential care. Non-negotiable. Smart copays to manage demand. Small fees. Big differences. Real investment in supply, doctors, capacity, tech. The countries doing all 3, Germany, Switzerland, the Netherlands, outperform both extremes. Pure free creates queues. Pure private creates bankruptcy. The countries getting it right aren't ideological. They're operational, universal access for what's essential, smart prices where they help, massive investment in supply, less politics, more plumbing. That's the actual answer. What's your country's system? And what's it actually like? Drop your country and your experience in the comments. If this gave you a useful frame, hit subscribe.